So much is made of the difference between ionizing radiation and non-ionizing radiation, as if to sort of dismiss the non-ionizing radiation as of no consequence, because after all, it's not ionizing. But the really surprising thing is, and I'd like to read a list of symptoms, shared symptoms, and I believe these are from workers of both the Chernobyl cleanup and common everyday exposures from those who are sensitive to synthetic fields. So, with regard to neurological symptoms that are shared, we have headaches, dizziness, memory loss, difficulty concentrating, depression, anxiety, insomnia, chronic fatigue, weakness, tremors, tingling, joint or muscle pain, and in severe cases, seizures and strokes observed in both groups. In terms of cardiac, we have palpitations, arrhythmias, chest pain, fluctuations in blood pressure, irregular heart rate, shortness of breath. In terms of respiratory, bronchitis, asthma, pneumonia, recurrent sinus infections, dermatological, skin rashes, itching, burning, sensations, flushing, abnormal sensitivity to touch, and ophthalmologic, eye pain, burning, pressure behind the eyes, deteriorating vision, and cataracts are shared effects. Auditory, buzzing, ringing, or other phantom sounds, tinnitus. Hearing loss. Reproductive, we have reduced fertility, abnormal menstruation, miscarriage, congenital anomalies. Hematological and immune system, we have anemia, abnormal platelet, white blood cell counts, immune suppression, susceptibility to infections, and then other or systemic digestive problems, abdominal pain, thyroid enlargement, hair loss, brittle nails, dental fragility, frequent nosebleeds, dehydration, light sensitivity. I have seen so many of these things, or people have shared so many of these things with me among my sensitive friends and clients as well. I guess I'll just pause for a moment here and ask you, is it true that these symptoms are shared both by synthetic people experiencing what we consider to be normal now, synthetic field exposures, as well as the workers that did the cleanup on Chernobyl, which was, of course, dealing with ionizing radiation?
Well, indeed, yes. And also, you can add other types of ionizing radiation like X ray damage, particularly in the beginning when people were heavily exposed to X rays. People didn't really realize, like radiologists, that it was dangerous. There is, for instance, memory stone, or what you call it. I think it's in Hamburg, in Germany, with more than 200 names of radiologists that in the early days died because they got radiation damage from the X-rays. Of course, today we protect both the medical doctors, the nurses, and the patients heavily from any exposure. And I read some years ago that the last 50 years in Sweden, the allowed exposure to X-rays have been reduced by 60 million times. And this is interesting because that means that 50 years ago, 60 million times more was still regarded as safe. And then you can go to the non-ionizing situation today, where very, very, very high exposure levels are regarded as safe. But maybe if you call me in, let's say, 50 years' time, then we will have a similar reduction. And also, very interestingly, I remember, and that would be during the 1980s when we started to take skin biopsies, and we collaborated together with histopathologists at the Department of Clinical Dermatology at the Karolinska Hospital. And one of them, he was an elderly gentleman, and he had seen skin biopsies from different categories being harmed by radionuclides like uranium, plutonium, radium, and so on. And when we saw dramatic increases in a cell type called mast cells, and they have nothing to do with telecom masts, It's a German name meaning a big, bloated cell type. And they are the key cells for allergies, asthmas, and other oversensitivities. And when you looked in the skin of the electrohypersensitive persons, there was a dramatic increase of these cells. And then I remember that this man, he brought out a textbook showing photographs from skin biopsies from radiation damaged people. And now I'm talking about the ionizing radiation damaged, and it was just the same type of dramatic increases of mast cells. And they are one of the outmost portions of our immune system and should react in such a way. And suddenly they obviously reacted in the same way to non-ionizing radiation, and also being safe. They were from ordinary household television sets and from ordinary household computer screens, completely within the guidelines of public exposure, and still the cells in the body reacted in such a way. And I remember I received a very prestigious award for our studies. And at the ceremony, I said I shouldn't have it. It was this other doctor because he was before me. But he was very generous and said that I could keep it for my research. So I did. And we continued collaborating.
So there is not a difference really between ionizing radiation exposure symptoms and non-ionizing radiation
Well, I
exposure
would say that,
symptoms.
yeah, I would say there is one difference, and that's the time scale. If you play with radium or plutonium, you get the damages of your body within seconds. It would take minutes, maybe more, for exposure to X-ray and similar. And of course, for other types of ionizing radiation, including ultraviolet light, it may take an afternoon out in the sun to get the kind of symptoms that you attribute to exposure from non-ionizing radiation. And of course, I would say the shortest time spans for such reactions seems to be, well, at least 1 hour, and sometimes a whole day or even days, because before the persons get the symptoms. So that's the difference. But when you look, for instance, in the microscope, it looks the same. But one took a second or two, others take minutes, hours, or days to appear.
Is it reasonable then to say that we know with ionizing radiation exposure that we see thyroid cancer, leukemia, cataracts, cardiovascular disease, neurological decline, and immune dysfunction? And these, of course, are not unique to people who have been exposed to ionizing radiation. But is it unreasonable then to wonder how many of such things might be attributable in our population today to non-ionizing radiation?
Oh, I love that. I love that way of reasoning, and that's exactly how we have been discussing here in Stockholm too. That maybe within this group, as you say, of damages from ionizing radiation of various types, maybe you have a subset, and it could be small or medium or big, that is actually dependent on the everyday continuous 24/7 exposure to non-ionizing radiation.